All right, everyone. Good morning. It is 11:31 on this fine day. I am R1. This is the Conduit. We have a nice special show for you today to end off our week on this June 3rd. Kitsap Public Health is back, and both of our guests are here today. Lindsey Camarena, which I always get her name wrong, and of course, Dr. Morrow. So let me go ahead and bring them both up. How are you fine folks doing today?
Doing great. Thanks, Marwan. How are you doing?
I'm blessed and highly favored as usual. Dr. Gibb, how you doing?
Doing all right, Marwan. Thanks for having us. Looking forward to the conversation.
Yeah, absolutely. Absolutely. We already have people in the chat, so that's great. There's Pastor Ellington saying hello to everyone. So hello to you, Pastor Ellington. Thank you for tuning in today. So, we haven't had a conversation in several months, and, there's stuff going on in the news, and just figured it would definitely be good to have Kitsap Public Health come on and kind of update us, let us know what's happening in the now and, what we might see on the horizon. And, just kind of get into it a little bit. Hey, Jessica, how you doing? Good to see you. So, some things that I've been watching in the news. And what's interesting is stats and data can be used in different ways, and I should probably bring up our local data here that you guys put up for us every week, which is fantastic. But I was reading that COVID is trending up nationwide, and that was kind of a concern to see that as we're moving into the summer months. But then the Kitsap Sun kind of put out an article and said that it was kind of flattening and holding at about 8%. And so I just wanted to hear it from the experts' mouths. What are we looking at in regards to COVID here in Kitsap County right now? And also our president ended up with, was it our president that ended up with COVID? Some high figures ended up with COVID here just recently. So it's
the governor, I think, yeah.
Governor Inslee, right? Everyone's getting hit with it right now. So what are you doing?
Marwan, I have a data resources page. I don't know if it would be good to have a visual to share that. And you'll have to remind me, am I able to share on here, or should I send it to you?
You can, okay. Absolutely. So at the bottom, or where you see your microphone camera, you'll see a little square with an arrow. That's your share screen.
I found it.
There you go.
All right. Let me see if I can find this dashboard that I'm wanting to share.
While Lindsey is sharing that, you can see the growth level of people's expertise in Zoom and digital platforms of being able to manipulate all of these different technologies.
Okay.
All right. You have control.
So you can see this COVID data dashboard, and this is available on our website. And really this just gives, you can look at the cases to the best of our ability, what we have. Now just go ahead and chime in if you want to, but the cases are vastly underreported because most folks these days are taking those home tests and they don't report them for whatever reason, just where we're in. So we take the case with a grain of salt. But here you can look down and see the hospitalizations and the deaths. And notably in May, it's out there that COVID's not happening anymore, that kind of thing. But there still were 10 deaths in our county last month. And then you also can look here to see the hospitalization rate. You can see I'm scrolling over. So it looked like 30 was the last reported back on May the 28th. So not just about a week ago. So Gib, I don't know if you had anything to add about COVID in the community right now.
I think the main thing is please don't just focus on the numbers. I mean, we do use this in a rough fashion, really, at this point to kind of understand the direction that things seem to be headed. But we are aware that we're really only picking up probably 1 in 5, maybe 1 in 6 cases of the actual circulating disease activity. So we're just not counting all the cases is the bottom line. There's a lot of circulating disease activity right now. You're right. The governor's got it. He's not the only one. I mean, it seems like everybody we know has it or has had it recently. And it's still a real thing. People are still getting hospitalized 30 a week in Kitsap, and people are still dying. So continue to take it seriously, I guess, is our ask of all of you.
Lindsey, would you mind bringing that graph back up? And I've put the link in there for folks that want to connect there to that page. So one of the things that Governor Inslee was saying was, don't panic. They're not going to shut down, and have us do that. But the stat that he was going to pay attention to was the hospitalizations, right? I mean, that's one that even if everything else is underreported, the hospitalizations are the hospitalizations. So that really is pretty accurate. Is that a safe assessment there, Dr. Morrow?
Yes, absolutely. The only caveat that I would throw in there with respect to hospitalizations is that everybody who gets hospitalized gets a COVID test. And so not all of those hospitalizations are caused by COVID. It's really difficult oftentimes to tease out the causality versus the, in there with it or in there because of it kind of dimensions. We do know that in counties that have really taken a deep dive into those numbers, it's probably 50-50, but still a lot of people who are in hospital with COVID.
And, Marwan, I would segue into that there's more tools available. Of course, we've got vaccines, and I know we're going to talk about that quite a bit, but we have therapeutics available now that we didn't have a year ago, even 6 months ago. And, in particular, there's oral antivirals. And that's something, if you test, and even a home positive test, you get in within those first 5 days and see your doctor, or, there's one test to treat site in Kitsap, but really the best thing to do is go ahead and call your doctor, see your doctor right away to see if you're a high risk individual. And there's a list of about 50 things that would make you eligible to get a therapeutic. And if you can get that quick, there's a higher chance that you're not going to go into the hospital. And I would just note that you could take those with prescription regardless of your vaccination status. And they're being prescribed widespread now. And I know, correct me if I'm wrong, Gib, but I believe like pretty much any provider in our county is able to prescribe it, and almost all the pharmacies are carrying it now. So it's very accessible. And I don't think it's maybe known about enough, but don't wait and see. If you think, I'm just going to see what happens and I'm a high risk person, go see your doctor right away.
Did you want to add to that, Dr. Gibb?
Yeah, that really important point. Thank you, Lindsey. And just the only thing I would add, I guess, is that those are still covered through the federal program is purchasing those for people. So it should not be there shouldn't be a big cost disincentive for anybody.
So if you wouldn't mind, Lindsey, could you walk us through, you were saying, hey, look, if you take a home test and you find out that, you're positive for COVID, if you go to your doctor and you can get some of those therapeutics within the first 5 days, can you talk about those therapeutics and kind of the steps that people can take and are recommended to take to kind of move through this in the best way possible, to not be hospitalized, or, if that was the case, or to, keep the infection minimized through, their families and friends and things of that nature?
Yeah, absolutely. So specifically, if you have any symptoms or even an exposure, like a high risk exposure where you were in contact with someone with COVID for, longer period of time, over 15 minutes, then take a test. And you have those home tests that are widespread now. And if not, you can go get one pretty easily. If you test positive and you're a high risk person, the next step should be that you're calling your provider. And you're finding out, can you get a telehealth appointment? Can you get an in-person appointment? What's available to you? And then go ahead and ask your provider specifically, am I eligible for treatment? And they'll go over the criteria list with you. And if you are, then they should give you a prescription for it, or you can ask for it. And then it's a 5-day course of oral medication. So just a simple pill to take, and you would take it for the whole course. And, it's I feel 89% effective.
Oh.
Paxlovid is the one I'm talking about, 89% effective at keeping folks out of the hospital. And I would add that if you test positive and you're not having any symptoms, you can still be eligible for it. You don't have to be sneezing and coughing and everything. So that's about the summary that I've got for you.
And so what was the name of that therapeutic?
That one is Paxlovid.
Paxlovid. Would you mind typing that in the private chat? I'll put that up there.
Yeah, I'll put it in the chat.
That's fantastic, because one, I didn't know the name of the therapeutic, and so I'm pretty sure there's a lot of other people that don't know that, or they're not aware of it. So for us, it's like, okay, well, we have the home test and we can take it and we'll take the precautions. But I didn't know that I could go and see my doctor and get help in that way. We've got a question in the chat here. Lindsey, can you speak to the COVID-19 notifications that we can subscribe to on our phones? They give a possible exposure date, but I have remained masked and limited indoor exposure. Do I still test 3 to 4 days, even without symptoms? Excellent question. Thank you, Christina.
So the subscribing on the phone, it's been a while since I've done that. I know I'm on there. I know it's in the setting. I'll have to grab my phone and see if I can get you those details. And so your question was, they give a possible exposure date of remain masked and limited indoor exposure. So I would say yes to go ahead and test again 3 to 4 days, even without symptoms. Yes, would be the answer to that.
Yeah. Hey, and can I just jump in a little bit with that? I mean, I think that testing is free, quick, easy, simple, interesting. There are all the reasons in the world to do it and very few not to. And you can get 8 per month sent to your home through the federal government at this point. I've been taking advantage of that and using those tests, using them frequently. I think it's interesting. The CDC shortened up the isolation period for people that have COVID recently to just 5 days, although the days 6 through 10, if you go out of your own home and stop isolating, you're supposed to wear a face covering when you're around other people, primarily as source control, so that you're trapping your own exhaled air. But the reality is that at least 40+% of people are still testing positive by a rapid antigen and thus presumably infected at day 6. That goes down a little bit each subsequent day. But even if you isolate for 5 days, are feeling fine at day 6, go back out in the general public, please put a mask on, because you do really, I mean, if each one of us tries to break the chain of transmission, we start tamping this thing down a little bit more effectively. So, keep your own personal, whatever you call it, reproduction number, R naught, if you will, at 0, and we'll get through this a little bit better, a little quicker.
Gotcha. Absolutely. Thank you for that, Dr. Gibb. And in the chat, Kitsap Public Health has put Washington notify for phone notifications, doh.wa.gov/emergencies/COVID-19/WA.notify for those that are just listening. And then also, Jessica put in here's the link to the State Department of Health COVID-19 Therapies Guide. And I won't read that one because that one's considerably longer, but that is a nice PDF there. And so if you watch this later, you can go ahead and click on the link or copy it. Lindsey mentioned Paxlovid. Did I pronounce that correctly? Good. All right. And then Christina says, we are over 50 and got our second booster shot. I didn't experience the same side effects as previous vaccinations. However, my spouse is experiencing expected side effects. Any words to give me peace of mind that I am inoculated? Does a booster account for strains of COVID-19? These are powerful questions here.
Yeah, I can tackle that first part there for sure. So yeah, even if you're not having a strong side effects, that the flu-like symptoms, the shakes, the chills, you're still vaccinated. it still counts, and you're still getting that immune response. And there's a lot we don't know about why does one person have a stronger side effect than another. We all respond differently, but you can rest assured that if they got that needle in your arm and plunged a vaccine in, that you are vaccinated and boosted. So thank you for doing that. And let's see, do you want to speak about the variations and the strains a bit, or do you want me to tackle that too?
Go for it.
To the best of what the information we have, Christina, is that the vaccine is still providing protection against Omicron and all the subvariants from Omicron. Now, there is chatter of developing strain-specific vaccines, but we don't have any data on that yet. But we will come back on here with Marwan when we do.
Awesome.
We keep our ear to the door.
She says, thank you. I have a lot of questions. I used to reach out to Holly, so appreciate this conduit channel. And I appreciate you, Christina, for tuning in and asking questions that many people have and questions that they didn't know they should be asking. So thank you for that. Very powerful. I have a few questions also. Let's kind of switch directions here for a little bit. There's a lot of, conversations on, folks having long-term COVID complications and experiences. Can you speak to that and just, give us some accurate information to kind of cut through all the noise of, people still wanting to, I'm not going to get vaccinated. I'm not going to get the booster. And can you just speak to that? Because I think that's, we still have to stay vigilant. This thing is still here. It's not going away. I thought this thing would almost be, I don't know, not gone, but I didn't think it would be at these levels. And we're here just going into the summer, and we're looking at these levels. Can you speak to that a little bit?
Yeah, sure. And we had a talking point. We wanted to speak about summer safety as well. Long-term side effects from vaccination, we're not hearing that. Definitely some have a bit more prolonged than others, like, you have a swollen lymph gland, flu-like symptoms for a week. But in comparison to if you get COVID and you have long COVID, and it's some folks a year plus out still having foggy memory and that brain fog you hear about, fatigue, respiratory issues, seeing pulmonologists long term, even like some young healthy folks. So it's any side effect from the vaccine, it is reported in bears, so it is being tracked. They look for those safety signals, which we're transparent about. But yeah, I don't know if that answers your question, Marwan, but definitely, there's many things we can do to protect ourselves in addition to being vaccinated. Is, wear a mask when you're in an indoor situation, high risk situation. Wear a mask when you're traveling. We've got the test kits that are widespread now. So go ahead and test if you've had an exposure, or, I will, if I'm going to get together with some close friends, we go ahead and just do a test before we meet, just to make sure that we're being as safe as possible. And then, move things outside with good airflow whenever you can. Outdoor is still safer than indoor. So there's a lot of things. And then those therapeutics I talked about, if you do pop a positive test, then you go see, especially your high risk person, go get treatment. And Gib, I'm sure you have a couple things to add about this, but to hear that.
Well, yeah, thank you, Lindsey. Yeah, and the one of the messages we'll be promoting a little bit and pushing forward with is, as we get into wildfire kind of season, smoke season, it's that particulate matter, 2.5 microns in size. It's the little particulates that you get from wildfire smoke, from diesel engine burning, that really are problematic. And we're going to really try to encourage people and give them the tools and the kits to be able to create these sort of safe, clean air spaces in their homes, in that same, kind of box fan with a HEPA filter system that works to purify particulate matter out of, kind of dirty air also cleans viruses out. So it's kind of a good thing to be thinking towards a little bit. When the air quality is good, doing things outdoors, absolutely really important. With respect to the long COVID, time is going to really tell, I think, in that regard. Already, we do know that, as with so many other infectious diseases, autoimmune issues do occur. There's been a lot of evidence that shows that, type 1 diabetes, which is an autoimmune destruction of the pancreatic islet cells that produce insulin, can occur. And that is something that will often follow on the heels of significant viral infections of a variety of different sorts. But Lindsey mentioned the sort of the brain fog. I mean, there are cognitive issues that can occur. There are cardiac issues. There are vascular issues. There's, the potential for pulmonary scarring. There are renal kidney issues. I think we're going to be digging out of this for a long time. The other thing that wasn't mentioned, and I think is a really important one, is the mental health complications, that collateral damage impact from, a generation of kids being socially isolated and really, witnessing not only a pandemic at a really important formative point in their lives, but also in the context of a lot of the other upheavals, war in the Ukraine, displacement of many people, political disruptions here at home, gun violence, mass shootings. This clinic-based shooting in Tulsa was the 230th mass shooting in the country this year to date. We're starting to see gun violence. It took an upward trajectory there in 2020, quarter four. And I think that there are very significant, not only health consequences, but mental health issues that are going to be fallout from this. And we really are going to want to try to figure out ways of addressing those issues proactively, getting a little bit ahead of them, and dealing with them is really a public health issue of significant consequence.
That definitely seems like one, it's definitely necessary, but it seems like such a heavy lift, as folks are struggling with housing and everything else. So it's going to take everyone working together to try to slow this thing down, because it's almost daily now, and I think actually it is daily if you look at the actual numbers, right? Like the average is at least it's over one a day, right? Because half a year is 180 and they're at 200 already, so it's pretty crazy. Just to talk back really quickly and touch on just kind of the myths of this long-term COVID. The thing that makes me feel comfortable is you consume so much information from all these places, but we are pretty far out from having the vaccine now. So we can look at that. And so I feel pretty comfortable with saying, okay, I feel like the, Moderna and the other ones are safe, because I'm not seeing anything alarming from when we didn't know as much as we did before. But now we've got this time, we're so far away from it now. And it's like, okay, yeah, obviously nothing's going to be perfect and there's going to be issues. Everyone's different, but there's no alarming, real spikes there that needs to be of concern. And I'm still having conversations with folks that still aren't vaccinated or saying, okay, I got vaccinated, but I'm not going to get the booster. And so I think those are important conversations to have. Is my assessment pretty good there, Lindsey, in your estimation?
Yeah, I think so. And I know that some folks are hesitant to get vaccinated at all, and then there's some that don't want to get boosted. But, especially if you are a higher risk individual or you're around people that are, you still can pass it more easily if you're not vaccinated. And you still increase your risk of being hospitalized and even dying from COVID. And, Marwan, we talked about it, like my healthy mid 40-year-old brother-in-law died last October from it. And was not vaccinated. So that was Delta. So no, we're not in Delta, but as you saw, we pointed out those 10 deaths in May, and it's still happening. So, we can't fully let our guard down, and I wish I could say we could, but we still need to be careful and do what we can. So a booster is a safe way to protect yourself. And, I will say that this kind of brings me to a couple plugs to make. Like, one is you can go to our website. We are offering in-office vaccines to the community. It's pretty easy to sign up, or you can call that phone number that Marwan put in the chat, and we can get you signed up on Wednesdays or Thursdays. And we're offering all the vaccines that are approved for COVID right now. The other thing is we're going to be participating in a couple events later this month. The first one is the NAACP event in partnership with the Sinclair Missionary Baptist Church. And that will be June 16th. We'll be there from 12 to 2. And then we'll also be at the Juneteenth event on June 18th at the Evergreen Rotary Park in Bremerton. And we will be there from 11 to 1. So if you are interested in visiting us there, we'll also have a health booth right next to the vaccine clinic. So we're there for more than just vaccines, because although COVID's been a big focus, the health district does so much more than that. But we would love to see you there for a booster, or just to talk vaccine, or talk about anything. It's just a good connecting point and a great event. 2 great events being put on.
So at both the Sinclair event and Juneteenth at Evergreen Park, vaccinations will be able to, and boosters will be available?
That's right.
Oh, that's fantastic. Okay. And then Jessica just put up the link for the NAACP resource fair. So let me go ahead and pop that in there. Christina says, I'm sorry for your loss, Lindsey. Glad to hear vaccinations are offered at the health district and events. Absolutely.
And just to follow up on that, I mean, it is an incredibly just heart-wrenching, if that's the word, story. And Lindsey's niece was recently featured on public broadcasting, PBS NewsHour with Judy Woodruff. Had an interview with her about this issue and about that vaccine hesitancy that really we hope is kind of fading off into history. I think that time has really confirmed a lot of what we were saying and seeing and trying to communicate to the public, from back a year ago now, is really when we were in that mad scramble to try so hard to convince people to start getting vaccinated, and just a lot of courage and tragedy on the part of that family. And Lindsey, I mean, just the fact that you put that out there and talked to our health board about that, I think it brought tremendous value to our efforts to get Kitsap vaccinated and inspire confidence in people moving forward with that approach. So you and your family are really to be commended for that. So
absolutely. Pastor Ellington says, I would like to get my second booster. Is the J&J vaccine still available?
Yeah, but we want.
That's a great.
Let me answer this one. Yes, but, or should I say yes and? Yes, and we would like you to get an mRNA vaccine. It's there aren't a lot of good reasons to get Johnson & Johnson. We've the CDC and all the data shows that you get better efficacy by far out of the mRNA vaccines, and far, far, far better safety. Safety with vaccines is the name of the game. I mean, vaccines really do need to be essentially flawlessly safe. Or as close to it as possible, because it is something that you're putting in your body to prevent something else. So we do know that Johnson & Johnson does cause some clotting issues, some platelet issues. It can cause Guillain-Barré syndrome, which is a ascending neurologic condition that can result in stocking glove distribution, hand and foot, initially weakness and paralysis, but it can really progress and be a significant issue. Again, these are all very, very rare, but they're not zero, and mRNA vaccines are really the way to go. So if you do want to get Johnson & Johnson, what we're requiring at the health district is that you go have that discussion with your doctor, who can review your own personal risks and benefits, discuss the alternatives with you at an individual level. And if you still want to get the Johnson & Johnson after that discussion, you bring your note in from your doc saying he or she would like you to receive that vaccine, and we'll give it to you.
Oh, that's a powerful question there. Thank you for the question and for the answer. This one is specific for you, Dr. Gibb. Forgive me in advance for asking a question that you may not have an answer for and may not be directly related to the topic of vaccinations. But in case you do, we are hearing that the coroner's office hasn't been answering their phone this week, causing challenges for coordinating funeral arrangements. Respectfully, do you see an uptick in deaths that may cause capacity issues?
I don't know anything about that. I'm unaware of any capacity issues over there. I did have some email correspondence with both the medical examiner and the coroner this week. They were actually planning on coming to do a visit at the health district, but I don't know the answer to that question.
All right, thank you for that. Well, as we wrap up, one thing I did want to share with Kitsap Public Health District is Gather Together, Grow Together, and Kitsap Long-Term Aging and Care have just finished their contract. So we are now able to provide transportation to those that are over the age of 60 or disabled to get vaccinated or get boosters. And so they will need to call Kitsap Long-Term Aging and Care, but if they do call our number, we'll connect them with them and get them straight away, set up and taken care of. So that is effective as of Tuesday. So we just had our meeting and set that up. So that is new and hot off the press. I think it's great that we're doing it now because, it's important now, but definitely as we go into the fall and the winter, our disabled and our elderly definitely going to need their boosters and everything else. So I wanted to share that information with Kitsap Public Health. And then I wanted to give you the final word and whatever bullet points you wanted to share as we continue on with our busy days.
I guess I've got a couple things to add before we move on. The first is that I know a lot of parents are anxious about vaccinating their under 5 kiddos, and we are expecting approval by late June. I'll say mid-June. There should be the FDA talks and that kind of thing, but by late June. So just keep an eye out for that. And then the other thing that I wanted to share is that we are now accepting applications for the health board. And as far as I know, this is the first time that Kitsap Public Health has opened up this type of thing. But we are seeking 3 non-elected community representatives. So if you are interested in applying, you can go to kitsappublichealth.org, and right there in the middle of the page, you can see a link to click to apply. So, and I cannot remember when that closes, but I want to say in about a week and a half.
Yeah, thanks, Lindsey. Yeah, it's open through June 13th. We really are viewing this as a fantastic opportunity to bring in some top new talent, increase the diversity, make it a more inclusive health board. The reason that we're doing this is because of statewide legislation. There was a House Bill 1152 that passed requiring health boards to have equal number of elected and non-elected representatives. And we'll be adding 2 tribal representatives. Those are people who are going to be nominated from the American Indian Health Commission. But then there will be 3 additional Kitsap representatives. We're starting to get those applications coming in, and we would love to see as many as possible, and really appreciate anybody who's interested in serving in that capacity and or maybe some sort of downstream advisory capacity in the future. Time will tell how things evolve, but we are looking to get those positions filled as of next year, this summer, early fall.
All right, and I've got the website up where you can do it. I actually talked about this on the Conduit last week a little bit, but the position description is here. The application form, which is super simple, is right here in the middle, and then frequently asked questions. And so my question would be, I take it, are the 2 of you on this board?
So neither of us are on the health board. I, as the health officer, report to the health board and am appointed by the health board. But the health board currently is comprised of the 3 county commissioners and then mayors of 4 different municipalities. So it's a board of 7. As things roll into this next phase, which really is going to start in July, it'll be 2 from the tribal communities. There will be 4 electeds, or I'm sorry, 5 electeds. So 1 county commissioner in the 4 municipalities all represented, and then there'll be 3 non-electeds. And those non-electeds need to come from 3 different general buckets, one of which is healthcare or public health practitioners. The other is customers of public health, which I think each and every one of us in Kitsap County is at this point. And then the third bucket is a stakeholder. So a community-based organization, or there are some specific criteria associated with that, but that is all up and available on the website. And the application process, when you read through it, you just self-identify as being somebody who works in healthcare, public health, or a community customer or a stakeholder. So hopefully it's a easy enough, straightforward application that will not deter people from doing it, but instead generate some interest and get some synergy of efforts if we can, and a little bit of fresh perspective. It's always a good thing.
Christina asked, do you know if the school board official can serve in this capacity on the health board?
I don't see why they couldn't.
And I'm just kind of scrolling through the application here. It is a pretty easy application here, so very low barrier. I just did you have some other points, Lindsey?
No, I don't think so, unless there's anything you wanted us to touch on.
I just wanted to pose a question, just in the two of you, in your own words. Why is this board important?
I'll take that one.
Go ahead. Yep.
So there's a guy named William Fagey who was the director of the CDC a while back. He was a very important public health figure, and he made the comment once that nothing is outside of the scope or purview of public health, and it really is true. I mean, public health nowadays is really looking at those very upstream determinants of health. We know that 80% of health outcomes are determined through, non-medical, but more social systems, i.e., good family, good education, good housing, access to food, good built spaces, healthy environments, traffic laws. I mean, and so all of these things play into public health. And so really I transitioned to public health because I don't think there's anything more important on the planet, nor more interesting. I think it is gratifying to be part of it. It's a wonderful opportunity to be involved in policy direction and influence our community to really ultimately at the end of the day, make it easier for people to make the right health choices. I think that's kind of what public health is ultimately all about. It's not just about kind of COVID containment, disease management, vaccination, but it is about a broader perspective on all of those different things that impact health. And it's an important job, and it's one that I think is potentially very influential and deserves to have a good diversity of perspective and good committed people who are helping guide the efforts and amplify the work that we do and direct it.
I think that's a fantastic answer. I love it. I just wanted to let everyone know too that if you do need one of the free kits, they are everywhere. Our libraries have them, especially downtown. New Horizon Missionary, at all the events, they'll have them. We have them at G2. They are everywhere. So as Dr. Gibb was saying, you can get 8 per month, but they're all over. So these things are so accessible now where they weren't before. So, I just wanted to make sure I showed you so you can see what they look like. That they are everywhere. And you can always reach out to us or Kitsap Public Health if you need some, and we will definitely get them to you for sure. I want to thank you both for coming on today. This was chock full of information. I learned a ton today, and I love when people are on and asking questions because I can only think to ask so many things. And the J&J and the therapeutics was all a learning experience for me. So thank you both so much for taking some time out today.
Thank you. Pleasure to be on here, Marwan.
Yeah, thanks, Marwan. It's always a pleasure. Really enjoy speaking with you and appreciate you for doing this.
Yeah, absolutely. I know there's some talks in the back about us, you guys coming on a more regular basis and talking about different things that Kitsap Public Health does. Because if you look at the website, it's more than just COVID. It's a lot more. So stay tuned for that. And then, as Lindsey was saying, once the under 5 vaccination information comes out, we will have them back on, unless they come back sooner, because there's some news that we need to push out there. So either one of you want the final word?
Wait, monkeypox.
Monkeypox.
We got through the whole thing without saying it once. So
You really want to go down that rabbit hole?
On that note, TGIF.
Right.
Yeah, that's right. Until next time, we got to leave you wanting for more. So for Dr. Gibb Morrow and Lindsey Camarena from Kitsap Public Health, I am Marwan Cameron. This is The Conduit. Enjoy your weekend, everyone, and we'll see you next time.